Hi, my name is Chris DeBose, and I'm a nurse practitioner student at Auburn University's Graduate School of Nursing. And today I'm going to be discussing with you my class of medication, which is calcium channel blockers. Calcium channel blockers are a class of medication that can be used as an antiarrhythmic, an antihypertensive, or as an anti-anginal. Common names for drugs for the calcium channel blockers I like to look at as very nice drugs. So you have V for verapamil, nice for nifedipine, and drugs for diltiazem. There are also other drugs such as phenylopine, nicardipine, isopidipine. So as you can see, most of the drugs in the calcium channel blocker have the ending of pine, P-I-N-E. So that's how you can differentiate them. The action of calcium channel blockers is that calcium channel blockers block access of calcium of the heart into the heart and to the arteries. And therapeutic effects are a cause of arterial dilatation, reduced contractility and conductivity of the heart, which lead to a decrease in oxygen demand in the heart, leading to lower blood pressure and lower heart rate. Calcium channel blockers reduce electrical conduction within the heart. They decrease the force of contraction or the work of the heart, and they dilate the arteries. The combination of the reduced demand for oxygen, increased delivery of oxygen, prevents angina or heart pain. Dilatation for the arteries leads to reduced blood pressure. In addition to the calcium channel blockers, they slow the electrical conductivity through the heart and thereby correcting abnormal or fast irregular heartbeats such as AFib. The pharmacodynamics of calcium channel blockers are that it works by blocking the voltage dependent calcium channels. Since these channels are concentrated in the SA and the AV node, these drugs help by decreasing the conduction through the AV node. They inhibit the inward movement of calcium, and they decrease the contractility, the automaticity, and the AV conduction of the heart. The pharmacokinetics of calcium channel blockers is it's absorbed orally. It's distributed through most bodily tissues, including placenta. So this is a class C medication. Nifedipine is the only drug that is indicated for the use if a woman is lactating, but calcium channel blockers are safe for pregnancy. It's metabolized in the liver, and it is excreted in the urine and the feces. The pharmacodynamics of calcium channel blockers is that precautions is its use caution should be used in patients that have hypotension, AV block, heart block, acute MI, or pulmonary congestion. Calcium channel blockers are contraindicated in patients that have an ejection fracture of less than 40% because it's a negative ionotropic effect and it can cause bradycardia. It also should not be used in patients that have a SA or an AV node conduction disturbances, patients with a systolic blood pressure of less than 90. Should not be treated with calcium channel blockers because of a higher risk of induction of heart failure or significant hypertension. Adverse drug reactions with calcium channel blockers are that in use with any other antihypertensive, it can induce the effect causing hypertension or hypotension rather. Calcium channel blockers concurrently with use of NSAIDs can decrease the effect of calcium channel blockers. The very nice drugs for verapamil, diltiazem, and nifedipine should not be used with digoxin because it can increase DIG levels and cause DIG toxicity. Indications of use are chasms. So you got cerebral spasms, hypertension, angina, migraines, and AFib and a flutter. Patient education that you want to use for this is they need to take their medicine every day, same time, same place. If they miss a dose, unless it's close to the next dose, it's so safe to take it. Otherwise, they need to wait for the next dose. If with diet, they need to not have a high-fat diet, a high carbohydrate diet, and they also need to not drink grapefruit juice while they're taking this medicine, because those can all decrease the effects of the medication. The takeaways that I would like you to have from this are that calcium channel blockers, they're very nice drugs. So verapamil, nifedipine, and diltiazem, they're used for CHASM, chest pain, or cerebral spasms, hypertension, angina, migraines, and AFib. They are the drug of choice for AFib. Also, takeaways is food. Watch what you eat while you're taking these. No grapefruit juice, no high-fat meals, and no high carbohydrate meals. Thank you very much, and have a great night.